Hello, my name is Mallory Brown. I'm currently a doctoral candidate at the University of Kentucky within the Department of Kinesiology and Health Promotion. I'm going to be sharing with you all the systematic review that I completed as part of my dissertation research that revolves around the food environment within recreation facilities where youth often participate in organized sports. So a little background of the literature regarding childhood obesity. In a more general sense, worldwide obesity rates, this includes children and adults, it tripled between 1975 and 2016. And while we do know that there are certain demographics of individuals that are more likely to develop obesity, we also know that currently 1 out of 5 children in the United States are obese at this time. There are lots of impacts of childhood obesity. There are lots of negative consequences. I will just mention a few of those here. Unfortunately, a lot of times obese children will be bullied by their peers. Additionally, oftentimes they will have physical limitations in what they were able to do just because of their body weight and the extra stress on their body that the weight puts on them. Unfortunately, they're also predisposed to developing chronic illnesses that we typically don't see manifest until adulthood, but we are seeing children that are developing these chronic disease states like heart disease and diabetes, specifically type 2 diabetes at a very young age. For a really long time, type 1 diabetes was called it was the youth onset diabetes, and type 2 was adult onset, but it is no longer referred to as that because of the fact that children are developing type 2 diabetes very early on. In addition to the things I've already mentioned, obese children are much more likely to miss school than their normal weight counterparts, and they are also more likely to be obese into adulthood, which is a long-term effect that is very troubling. And so the idea is that if we can work to prevent childhood obesity, we will then prevent for more adults in the future from being obese. We know that regular physical activity is really, really important for children's overall health. And we do know that when children participate in regular physical activity, that they will have a lesser instance of being obese. Now, that is oftentimes coupled with the food that children consume, because it is certainly an overall picture. Regular physical activity alone is not going to prevent obesity, but regular physical activity is incredibly important for cardiovascular health and for making sure that children are moving and active, and it does contribute to their overall health. And organized sports provide the opportunity for a lot of kids in the United States. Specifically, in 2019, more than half of the kids aged 6 to 17 participated in team sports. Unfortunately, though, a lot of the food environments embedded within sports or embedded within the recreation facilities where these sports take place have been described as obesogenic. And this essentially just means that it promotes obesity. Okay, and a lot of times we wouldn't think about this particular environment as being a risk factor to developing obesity. We would typically think of an environment where children participate in physical activity as a protective environment, but unfortunately 2 previous systematic reviews did say and came to the conclusion that the included studies, the included environments that they researched were definitely promoting obesity. Now, with that said, the research that was conducted, the first systematic review was conducted in 2011, and the second one was in 2017. Additionally, even still, at this point now, the research around this area is very, very limited, and that was listed as a limitation of both of the previous systematic reviews. Additionally, those systematic reviews also used the Angelo framework, which just simply stands for the analysis grid for environments linked to obesity. And unfortunately, some of the studies that were included in the systematic reviews were not specific to the food environments within recreation facilities and linked to children participating in sports or organized physical activity. And so some of the information that was presented in those reviews was not necessarily pertinent to recreation facilities specifically. So for this systematic review, I wanted to use a different framework, and the framework that I chose to use is the NCCOR Food Environment Assessment Framework. And NCCOR is the National Collaborative for Childhood Obesity Research, and there are a number of measures within their measure registry that focus on different aspects of environments where children spend time. Now, through the research, I did not find that there was a tool that specifically related to recreation facilities, but the way that this was broken down, I thought that this would be really easy to tailor and to use with the recreation facilities, because within each of these domains, the measures listed there can easily be translated and used for recreation facilities. And so you can see here the three domains that they have are the physical food environment, the social food environment, and the person-centered environment. And you can see the different examples of those things there. So as I was conducting the systematic review, everything I did, I tried to maintain as close of alignment with this framework as possible when I was making the distinctions with the studies included in my review. So my overall research question for this systematic review was, which physical, social, and person-centered national collaborative on childhood obesity research domain measures of the food environment where children participate in organized recreational activities have been studied in the current research? And I defined the current research starting in 2000 and then ending in 2020. So as far as the methodology is concerned, you can see the search terms that were decided upon. This was a decision that was made by both me and my advisor, and we came up with terms that we thought would encompass anything having to do with snacks or food or the food environment, that would really get us at looking at research that dealt specifically with this environment. And the databases that we chose to use are listed as follows. And we did use the exact same search terms for every single database. As far as the analysis of the data, the very first thing that I did was put all of the studies into a pre-designed table that had these headings: the author and the year, the study location, which was simply just the country where the study took place, the study environment, whether it be youth basketball, youth baseball, general recreation facility. I'd wanted to make that distinction. The NCCOR domain, either physical, social, person-centered, the number of study participants that each study had, the type of study participants, the type of study that the research was conducting, and then the overall outcomes for each study. As far as the quality assessment of the studies goes, I chose to use the Mixed Methods Assessment Tool. This tool is good, obviously, for using studies of mixed methods, and because the research in this area is so new and limited, I didn't want to exclude any type of research at all. And then a narrative synthesis was used for the results of the study. Some general results of the study: 32 studies were included, in the systematic review, and these studies took place in Canada, Australia, United States, New Zealand, and England. The majority of the studies included did take place in Canada or Australia, and the majority of the studies were just aiming to describe the food environment within the recreation facility. Only 25% of the studies included actually conducted an intervention to change some part of the food environment, but again, the majority of the studies included were just describing the current nature of what was happening within the food environments. And here I have listed for you the measures that were addressed within each of the domains. So the physical domain, we have the food availability that was in vending machines and or concession stands. Next, foods that were provided by adults, and typically this was talking about the food that was provided to children by adults. Nutrition information, and this just means that the nutrition information that was made available to influence decision making when it came to purchasing foods, food marketing, and then sponsorship of sport, and typically that referred to the sponsorship of children's sports. As far as the social environment, and this was by far the most studied domain, and within that domain we have the food consumption, and this meant the food that was consumed by individuals that were in the recreation facilities. Sometimes it was the children themselves, but other times it was spectators that were there to watch children play sports. Other things included price promotions, the presence of nutrition policies, implementation of nutrition policies, and efficacy of nutrition policies. And those three things were mentioned more often than any other measure. So policies were overwhelmingly popular when it came to the research there. As far as the person-centered domain, this really just means an individual's perceptions of the physical and the social environment. And so a couple of things that were addressed were the perceptions of availability and access to food at recreation facilities, and most often this was the perception of parents. It did on occasion include the perceptions of the children themselves that were participating. Another measure was the perception of nutrition policies and practices. Again, most of that research was the perception of either parents or recreation managers and their perceptions about implementing policies and how that would affect the overall food environment. And then last, but certainly not least, perceptions of social norms that existed around the different things that happen within the food environment within recreation facilities, whether it be the food that parents provided or the food that was available or any mixture of those things. But typically the social norms were addressed in terms of how parents perceived bringing snacks for kids and how those different social norms influenced the environment as well. So last, food environments do have several obesogenic properties. This systematic review added to that and further solidifies that we certainly do have a lot of issues when it comes to promoting obesity in what should be a protective environment. Another point is that only 5 studies have taken place in the United States. We know that childhood obesity is very prevalent here and it is very much a problem, and we should absolutely expand the research within the United States in different geographic regions and to cover more sports. As far as what was covered in the research in the United States, it was youth basketball, football, soccer, flag football, and so there's certainly need to further expand on that across the United States and across all sports.